The method of aspiration or cystocentesis for sterile collection of a urine sample was shown in the FAST exam DVD. Ballottement of the bladder prior to cystocentesis may help to circulate sediment for collection. The technique for fine needle biopsy of a bladder mass is the same as described and demonstrated in the FAST exam DVD. Fine needle biopsy of a suspected bladder neoplasia is controversial. Seeding of the transitional cell carcinoma into the abdominal wall with fine needle biopsy has been reported. Fine needle biopsy of tumors in general has a low risk of seeding the tumor to other locations. Surgical biopsy also has a low risk of seeding. Every time a needle penetrates the abdominal wall, it should be discarded after one use. Needles should not be reused. This video is from a 14-year-old cat with chronic hematuria. The thickened bladder wall could indicate severe cystitis or neoplasia. Another form of biopsy is to pass a red rubber catheter into the bladder under ultrasound guidance and aspirate the mass into the catheter while pulling the catheter back and forth over the mass. The transducer can also be pressed into the mass while aspirating and rotating the catheter. This is known as traumatic catheterization, which could easily transplant tumor cells to the urethral surfaces. Shedding of tumor cells from the primary site occurs on a daily basis anyway. Delay in diagnosis or treatment of the mass is counterproductive. This video is of a transitional cell carcinoma in a dog. Did you see the mineralization and acoustic shadow of the mass? Did you see an enlarged lymph node dorsal to the urinary bladder? Was ballottement of the bladder useful in this case? Surgical biopsy and debulking of the mass can also be done. Any form of manipulation of the tumor can cause a shower of metastatic cells to be released into the general circulation. Only 1 in a million cancer cells actually takes root and develops into a metastatic lesion. The rest are destroyed by the body's immune system. Biopsy is necessary to identify the lesion and know how to treat it. It is always possible that the mass is not neoplastic. I recommend informing the owner of the risk and letting the owner decide to take the risk of biopsy or not. This video is from a dog showing chronic hematuria. Could these bladder masses be polyps on a stalk? Would you take the risk of biopsy? The distal urethra, vagina, and prepuce are not sterile, but the rest of the urinary tract normally is. Concentrated urine helps prevent urinary tract infections. In dogs, 20% of urinary tract infection cases are asymptomatic, but should be treated. Treatment of cystitis can be difficult. Long-term antibiotics for at least 6 weeks are usually needed. In some cases, bacteria may move into the bladder wall or intracellularly where they are not affected by antibiotics. Sometimes infection cannot be eliminated and repeat or pulse antibiotic therapy is needed. Removal of stones, crystals, polyps, or masses may be necessary. This video is from a 12-year-old corgi showing recurrent hematuria in spite of treatment over a period of 1 year. Transitional cell carcinoma is the most common neoplasia of the urinary tract in dogs and can be treated palliatively with nonsteroidal anti-inflammatory drugs like piroxicam, chemotherapy, palliative radiation, and surgical debulking of the tumor. Because most dogs die from complications secondary to urinary tract obstruction, placement of a urethral stent is a more recent palliative therapy that can be used.